All right. So the next group that we have some birth defects that are a combination of genetics and environmental. Okay. So we're going to talk about these. We have cleft lip and cleft palate. This is where there's a gap in the upper lip or palate. So upper lip is like this, maybe. We'll see. Okay. So where there's a gap in the upper lip, the palate is the roof of your mouth. That's that. Okay. So they can have a hard time eating and swallowing. They might have some bad ear infections. Genetic counseling can help because there is a genetic component to it. Taking prenatal vitamins can help prevent it, and not using tobacco or alcohol can help prevent this as well. Okay. The next one is cerebral palsy. This is a congenital disorder of movement, muscle tone, or posture. So, let me erase these. We don't need those on the screen anymore. Okay, so, people with cerebral palsy can have tremors or involuntary movements. They can have problems eating and swallowing, difficult speaking. Some prevention. If mom is vaccinated against diseases before becoming pregnant, that can help prevent cerebral palsy. Living a healthy lifestyle in order to prevent infections and preventing head injuries. Okay, those can all affect cerebral palsy. All right. I'm going to skip this video for now. I'll link it. If you have extra time, come watch it because it's amazing. The next one is spina bifida. Spina bifida is when the developing baby's spinal cord fails to develop properly. So they can actually be born with this little like bubble on the outside of their back that's actually a part of their spinal cord. So severe cases can cause physical disabilities. Folic acid. Folic acid is a vitamin that can actually help prevent spina bifida. This is one reason why prenatal vitamins are so important. So if possible, plan the pregnancy to ensure that mom is getting enough folic acid before becoming pregnant. Okay? That's important. So let's talk about some lifestyle things. These can influence environmental birth defects. So avoid all forms of drugs, nicotine, and alcohol. Okay. So this is on the next page of your packet, right? Right here, where it says lifestyle factors. Only use over-the-counter and prescribed medication under a doctor's care. Diseases and infections can transfer from mom to infant. Avoid exposure to x-rays, pollutants, and toxic substances. Get appropriate rest and manage stress. Those things can all help with not getting environmental birth defects. A risk for genetic birth defects increases if the age of mom is over 35. So that's why we say the optimum age for raising kids is 20 to 35. Well, I shouldn't say for raising, for having children. Seek early and continual medical attention and prenatal care. Maintain a proper diet because the placenta does not transfer essential nutrients to the fetus if the woman is undernourished. So if mom is not eating enough, the placenta or like mom's body does not actually send nutrients to the baby because they're needing everything that mom gets to keep mom alive. Exercise, walking and swimming are excellent exercises during pregnancy. An appropriate weight gain is 24 to 30 pounds during pregnancy. Something else to note is that birth defects can also just be caused by a defective sperm or ovum cell. Folic acid, right? Women of childbearing age who have inadequate folate intakes are more likely to give birth to babies with spina bifida. Damage may occur during the first weeks of pregnancy before a woman may realize she is pregnant. 400 milligrams of folic acid a day is recommended. So here are some foods that are filled with folic acid. So go ahead and pause this video so that you can write down 6 of those foods that are great sources of folic acid. Go ahead and pause it now. All right, so how do we know that a baby has a birth defect? There are 2 different tests before birth that can help us know if a baby is being born with a birth defect. The first one is an ultrasound. Lots of people are like, oh, ultrasounds help you know whether the baby is male or female. Yes, they do, but that's not their only purpose. They actually can tell if the baby is being born with a birth defect as well. The other one is called amniocentesis. Amniocentesis is when they take a needle and they insert it into the abdomen, into the uterus, and then they take out some of the fluid that surrounds the baby as the baby's growing, and then they pull it out and then they test that to see if the baby has like Down syndrome or other genetic birth defects. They can test that and see. So you need to know what amniocentesis is. All right, that is it for today. Go ahead and look at the instructions for your birth defect project and start working on that. If you have questions, you can ask somebody around you. But basically, you are going to be picking one birth defect from the list. You are going to be researching about it, answering the different questions that are on the assignment on a Google slide about that birth defect. If you have questions, look at the rubric. Thanks.